March Healthcare Classic every year is about a lot of things to a lot of people. And I know all of you at home who are following along are looking forward to, like we do, the perspectives of leaders across the industry, not just in their organization. And with me again here are four fantastic leaders that bring depth and expertise in the policy side of healthcare, which we at RO3 felt like was particularly important because of the trends that we've highlighted, particularly important in this time in healthcare to bring important perspectives to bear. And there is no doubt that the four folks that I have the privilege to share the screen with today are going to do exactly that. I'm going to ask them to introduce themselves, but as you've become accustomed to, they're going to give us a little bit of guidance on where they see the trend teams advancing and where they perhaps don't, and provide a little bit of perspectives. If we've done this successfully, we'll have a little bit of fun in the meantime. But with that, let me ask Leah Binder to start us off with a quick introduction, and then we'll move on to James Gelfand.
Great to be here. Thanks for having me. I'm Leah Binder. I am the president CEO of the Leapfrog Group. We are a nonprofit and we represent employers and other purchasers, especially, as well as consumers of healthcare, advancing quality and safety. And we are known for this hospital safety grade. That's probably the thing we're best known for, the ABCDRF we give all general hospitals in the United States.
Thanks, Leah. James?
Hi, James Gelfand, President and CEO of the ERISA Industry Committee, or ERIC for short. ERIC is a trade association that represents about 100 of the nation's largest employers that sponsor health benefits for tens of millions of Americans, workers, and their families.
Steve.
Hi, everyone. Great to be here. I'm Steve Sellars, CEO of the Urgent Care Association. We represent the field of urgent care, which consists of about 15,000 urgent care centers across the United States. And we deliver everyday health care to about 200 million patients a year.
And Stephanie.
Hi there, I'm Stephanie Mercado. I'm the CEO of NAHQ, the National Association for Healthcare Quality. Our core focus is to advance quality, safety, and financial objectives through leveraging the workforce. We focus on readying the workforce with workforce competencies so that they can take all of the policy and the practice and the mandates and the ambitions for quality and safety and really translate them into actionable workflows, work streams, and capabilities to make sure that we can deliver on our goals.
So as you can see, we've got four powerhouse voices in the policy space here that cut across healthcare to help us understand perhaps what policy trend might reign supreme when we get to the championship matchup this year. We'll find out in a few minutes. Let's look, guys, if you don't mind, and Leah, I'm going to go to you first. Let's look at the bracket as a whole. What popped out at you as you looked at the different trends this year in the provider, the purchaser plan, the pioneer, the policy region? Are there one, two, maybe three trends that jumped out at you as these are teams to beat? These are trends that we really need to be thinking about, or perhaps the opposite, that just it didn't feel like it quite captured the attention of the healthcare industry at large. What struck you as particularly interesting?
Well, I'll pick three that I think did stand out for me. The first is rural health transformation. I don't think it's the year for this team, but I think this team is coming of age, let's put it that way. And I think in maybe 1 or 2 years, this would be the team to beat. I think rural health transformation is going to impact all of us, whether you're in a rural area or not, because I don't think there's a lot of tolerance for things like the lack of obstetric access, maternity care access for people in rural areas. There's not going to be a lot of tolerance for that, and we're seeing a lot of closures. And so what that will mean is that health systems are going to have more accountability for rural health. Even if they own any facilities there, they're going to start to have more accountability. So I think that's coming. That's not here yet. So I think that's not going to win this year, but it's one to watch. I think price transparency is a clear front runner. So I will be looking at that one. That is a huge trend right now. It's very popular. And then I also think the other one that's maybe not quite as much front runner, but a good one is drug price shakeup. I think the Trump administration does intend to address drug pricing, already has in some pretty bold ways. But also, part of that is coming from consumers. I think consumers, there's more and more consumers who have more cash risk on their drug access. And that is actually shifting the market. We see that with GLP-1s. Talk more about that, but I think that's a maybe a sleeper team we should watch too.
I love those, Leah. Those are great call outs. Steve, do you see the bracket and a top side view? Do you see it any different?
So, looking at the full bracket, I think what stands out to me is this is a classic March Madness field. There's some very clear one seeds. You've got employers rewriting the benefits playbook. You've got AI becomes the new clinical infrastructure. But there's a lot of potential upsets. And you've got heavyweight programs like AI, employer-driven change, and cost pressure. And I see them as blue bloods. But I think what makes the overall bracket interesting to me is the depth. There's a lot of mid seeds here, like interoperability, telehealth, and price transparency that could certainly make a deep run. And so I think what it comes down to is execution. Some of these trends have been around for a while, so there's been a lot of hype with them. But now I think they're in the prove it tournament. That's what we have right here. And so the trends or teams that advance, to me, are going to be the ones that actually deliver results. And I think that's where the traditional favorites could get challenged this year.
Great perspective. You're settling in just fine in your first March Healthcare Classic.
I love March Madness, by the way.
Yeah, we're right there with you. James, has the seating committee gotten it right here, as it sounds like Steve and Leah are somewhat in agreement with?
We're going to agree with some, we're going to disagree with some. When I look at this bracket and I see old favorites like drug pricing shakeup or RX cost control intensifies, look, these issues are the GOAT. Like everybody wants this, everybody's talking about this, Congress, the administration, you name it. But you got some sleepers on here that you can't just ignore, that they're going to be putting in the effort. For one thing, the health tech ROI reckoning. So my member companies recently had an internal conversation, and the question that they asked is, have we reached peak point solution? Right? For the past 30 years, vendors have been coming to employers and health plans and saying, buy our thing and it will save money. Have costs gone down? Are we actually saving money? No, we're just spending more money on more services and more stuff. So I think that is one that absolutely I would be watching. Consumerism of healthcare demand. That's one that I would say they are going to flame out early on. And the reason for that is because we've kind of hit peak consumerism. There's about 30% of healthcare costs that are actually shoppable. The other 70%, you're just stuck. And for those 30%, you can't really make an informed decision when you're shopping unless you have accurate pricing, which consumers do not have, and accurate information about quality and value, which again, we don't have enough of that information to do it. So I think we'd like to be there. We're not there. It's not there here. The other one that I just wanted to briefly touch on is healthcare M&A under fire. This one's going to be big, okay? They could go all the way. You look at what's going on right now with the Department of Justice and with the FTC. DOJ's coming hard on hospital systems that have been using anti-competitive contracts. They just the other day sued the second system that's doing this. In the meantime, FTC, another major settlement with a giant healthcare conglomerate that controls a massive part of the insurance and PBM markets. So I'd be watching this one in a big way.
Yeah, I love that early on here, you're calling out a trend in your own side of the bracket. So I'm anticipating some really good conversation there when we drill into the policy world here in just a second. But not to be outdone, Stephanie, given the perspectives that you and the NAHQ team are working hard to continue to evolve on your competency framework and your point of view across the quality workforces and its enablement of the quality agenda in healthcare, are there things that when you look across the full bracket here, you think are more important for folks to bear in mind than another?
I do, and I have some broad statements, but first I want to comment on the March Healthcare Classic itself. I'm a little more partial to the Stanley Cup. My kids play hockey, and so I'm a little rattled, by the season here. We're winding down hockey, and we're sort of in that mindset. But in all seriousness, Josh, I am looking at this from a macro perspective, and NAHQ looks at this in sort of three broad categories, which you can see clearly throughout the entire bracket. And I'm going to sum it up in three words, which are care, cost, and cliff. And so when I look across the bracket, what I'm seeing is a real focus on what care is delivered, where that care is delivered, and how that care is delivered. And I think that there is a lot of, innovation in those areas. I think cost is a big one right now. Everyone's pocketbooks are under siege for a variety of different reasons. And I think, cost is, top of mind for everyone. And then when we go into Cliff, there's sort of two categories there for us. As one is, the workforce cliff. We are seeing unprecedented workforce shortages that are going to continue. And not only that, but a capabilities cliff. Workforce modernization is going to have to really kick into high gear if we're going to accomplish pretty much any of this, because what's on the board here requires transformation of pretty significant proportions. So as I sort of look across the board, I'm saying care, cost, cliff, but I think cost is going to really win out here in one way or another. So that's what I think is top of mind and what to watch.
Appreciate that as well as the other perspectives. Let's dive into policy. When we think about the way that these 8 trends are potentially going to impact how we think about healthcare over the course of the next 8 months, I'm sorry, over the course of the next 12 months. Stephanie, if you don't mind sticking with the mic for a second, when you took a look at these 8, how well did the seating committee do? Are these the right 8 trends in policy? Is there one or two that really hops out at you? We've already heard James is looking pretty hard at the 5 seed here.
Yeah, so when I look at the seed, I really, I'm very focused on price as the American public is as well. I was looking at interoperability. And just a couple of notes on that. First, I think that the data infrastructure required to really achieve our highest ambitions in healthcare are really anchored around interoperability. If we are going to get to a place where we have better data, and that data is moving through the system to really drive thoughtfully and effectively delivered healthcare, I think that this is really absolutely critical. And I think it is really going to help us move to improvements in a much more effective and efficient manner. And so I was sort of anchoring around this interoperability and saying, wow, we've been talking about that for a very long time. There's a lot of barriers in our way with that, but if we could accomplish that would be a game changer. Winning strategy, in fact.
I love that. Leah, how do you see this side of the bracket unfolding? Is there a trend or two that pops out at you, or you feel like it's going to particularly fall flat?
I have to agree with Stephanie that interoperability, that's a front runner. I think that we're seeing a lot of movement on interoperability. We see it now with uh, I think fire standards have come into their own far more than I think we anticipated they would, and faster than we thought they would. And I think there's a lot of momentum around interoperability. It's also fueled a little bit by AI. In terms of our expectations for as consumers, as purchasers, our expectations have grown hot. They've expanded, and when expectations expand in a marketplace, that does fuel a much faster movement. And we're seeing that with Inter. So I'd say they're an athletic team. Let's put it that way, and I think they have a good shot at getting somewhere. I'm not sure if they're going to be the champs. But I also want to reinforce the drug pricing shakeup as a very important one. And I don't. I want to reinforce why I think so, because this is where I disagree with James. I think that the drug pricing change is going to be driven in large part by consumers. I do think consumer action is going to be relevant to their effectiveness as a team, but not because they shop for care. I don't think consumers still shop much for care, although they do sometimes. We see it at Leapfrog, but they don't always. But they tend to create demand when they have to pay cash for something. And there's much more cash paying in drug pricing. And we saw that particularly with one of the champs from 2 years ago in this March Classic, which was GLP-1s. I think they won 2 years ago. And it was a surprise win. And GLP-1s have gone down in price substantially for cash pay, which is now a lot of the payment that's coming in for GLP-1s, and a very popular, obesity drug, et cetera. So extremely interesting to watch the trend there and what happens when there's more cash pay. I'm not saying it's good or bad, by the way. It just is a champion. And I think drug pricing, I think we're going to see much more change in that than we anticipated just from policy. It's not going to just be policy. It's going to also be consumer demand.
James, she called you out. I mean, it was just bold here, right out of the gate. So feel free, take it on. How do you see the policy side of the bracket shaking out?
Look, you want to dance? Let's dance, Leah. I think that I was first looking at the original matchup on the top, BBB individual market versus rural health transformation. You love to watch this match because you wish that these teams could play each other and both lose. They're both blown way out of proportion in the media and honestly have very little effect on the vast majority of people's lives. Individual market is tiny. 180 million people are getting their health insurance through a job. 100 million people are on a government plan. You're talking about maybe 20 million people in that individual market. So you could transform it all you want. It's hardly going to affect anybody. Rural health also, it's a money pit. Never seems to change. Always seems to be there as an excuse for why we shouldn't do anything and why we need to spend more money on healthcare. But hard to imagine anything's going to change. I might put interoperability in that same bucket because I was promised by President Bush that I would have an interoperable electronic medical record in 2008. It's 2026. One of my doctors just printed out 800 pages and sent it to me and made me pay cash for it. So, I don't see that going all the way. I agree. Drug pricing shakeup is a big one still. I think that at the end of this bracket, you're going to have healthcare M&A going up against drug pricing shakeup. Either party could take it. They're both teams that have a long way to go. But they've got the momentum, right? They're hot. They've got the players on both sides, the stakeholders that want to make it happen.
Steve, your colleagues have come in hot today. What are you thinking? How do you reflect on those comments and find a line through here on the policy side of the bracket?
So, on the policy bracket specifically, I think it gets really interesting, because it's more about the rules of the game and less about innovation. So my take, I think your 4 seed price transparency, that's a very important trend. It's one of those that's probably been in your tournament before. I'm not sure, but yeah. Okay. So I think, that one, transparency only matters if it changes behavior. And that's where, lower cost sites come into play. And, as consumers and employers get better access to usable data, I think you'll see real pressure on site of care decisions. Another interesting trend to me, telehealth at a crossroads. I think telehealth had its Cinderella run back during COVID, and now it's sort of trying to prove it belongs in the top tier. But to me, the future isn't virtual versus in person, it's how the two work together. And, when you're seeing models emerge like direct to employer contracting and direct primary care models and things like that, where those are integrated well, I think there's a real opportunity there. Other seeds here, drug pricing, very strong 2 seed, huge financial implications across the system. So, that's kind of how I see it. I think we'll get into, who's going to come out of this particular bracket here coming up.
Yeah, let's stick with you, Steve, if you don't mind, and look at the first matchup because it hits your constituents, both of them hits your constituents pretty hard, depending on to the positive or to the negative. When we think about what the one big beautiful bill has done in rewriting individual coverage rules, the impact to the urgent care community is significant, particularly for a population that prefers on demand care more than they do attributed primary care, more than they do the loyal primary care base. They want the care when they want it, how they want it, and they're using the constituents that you represent perhaps to take advantage of what the rewriting of these coverage rules could do, particularly when you think about affordability and stability. The converse to that, and Leah has already called out rural health transformation as perhaps a bit too early in their journey here in the tournament, but nevertheless, they made the tournament. So when you think about the implications of rural health around the country, rural hospitals continuing to close, margins compromised even more so than they have ever been, and the implications to in some communities around the country where the CVSs and the Walgreens of the world are their only option, or freestanding urgent cares are out there. How do you jive this matchup when you think about the constituents that you represent?
So I think the one big beautiful bill is a one seed for a reason. It sets the foundation for how coverage works in the individual market. And anytime you change subsidy structures and affordability, I think you're changing who shows up in the system and where they seek care. And so when coverage becomes less stable and less affordable, I think you tend to see more episodic, access driven care. And you're right. I think that's where urgent care often becomes the default front door, even more, in my opinion, because it's built for immediate on demand access. And so that's how I see that. I see them, the one big beautiful bill, advancing in this particular matchup.
Leah, do you see that matchup any different?
Well, I'm struggling with this one because these teams they're not as strong as they should be in my mind. I think rural health transformation is overall in this category probably that yeah, overall I think that's the one to watch.
Strong statement, particularly given that a former leapfrogger is the leader of the Rural Health Transformation Office, and Alina Chekai, who's trying to do her level best to guide us through that $50 billion across the country and transform the way we think about rural health. So I think there may be a little bit of inside leapfrogging here. Is that what we got going on?
Well, maybe a little.
Maybe a little. I know you're a fan, so am I. But I do appreciate the perspective. It's a big deal. I mean, we need to be thinking differently. And if the One Big Beautiful Bill Act perhaps is overblown in the way that it thinks about individual coverage and its implications, then you could certainly see an upset here. So I'm glad you called it out early.
I think rural health transformation is the future. It's and it's going to impact all of us. It's not just rural health and I think it's partly the future because they have influence. The rural Americans have a lot of influence on the electorate, and just the way the way that our elections are structured. Rural Americans have an outsized impact on who's in the Senate, for instance, and I think there's a lot of sort of almost nostalgia that a lot of people have toward farmlands and and areas of the country that are really grounded on the earth and communities, just a strong senses of communities and small towns. And we love that. And so I think there's a sense of that. And I think when we see problems with rural health, I think a lot of people get involved in it. And from an economic point of view, it becomes an urgency to figure out how we're going to make sure folks in rural communities are taken care of. So I just see that as a sleeper, but definitely a very strong team.
I like it. James, before we go to Stephanie to round out our thinking here, How do you think about what your colleagues' perspectives are, and what should we look out for in this matchup?
I was originally extremely skeptical of rural health, particularly the $50 billion that was part of BBB. Figured it was put in there just to buy off some votes to make sure people were comfortable with big Medicaid cuts, and it's just going to be another slush fund. But what's interesting is when that $50 billion was appropriated by Congress, the administration took a very sort of Illinois, former Illinois governor, when he's talking about the Senate seat, he said, Senate seat's an effing valuable thing. You don't just give it away. And that seems to be the way that the administration is treating this $50 billion. So what they're doing is they put a number of conditions on getting that money, and a state gets ranked based on which of those conditions they are meeting. And some of those conditions are awesome. Like, for instance, eliminating barriers to telehealth, facilitating interstate licensure for certain kinds of specialists so that there's less of a shortage and there's better access to care in your state. A lot of these things are transformative to the medical accessibility of care in that state. So I would say they're going to have a leg up because it's gotten a lot more interesting. People want to watch it. People want to see. People want to be a part of that.
I love it. Stephanie, the quality workforce is implicated here on either side, whether direct or indirect. But I know you've got perspective here to share with us. Do you see one of these two perhaps going far?
I'm looking at rural health transformation. I was very pleased to see the emphasis on workforce in the administration's approach to this rural health transformation. I think that there are some real challenges with workforce in the rural community, particularly around the areas of recruitment and retention of qualified individuals to really help advance this agenda item. I would also say that when we are looking at capabilities, again, I mean, there's a real lack of, capabilities and the ability for people to really be delivering the type of care that needs to be delivered in these areas, particularly when you're talking about the remote access and the telehealth connection here as well. I think we need to sharpen our pencils on that and say, what would it really take to make sure that we have much more emphasis in the population health associated issues and additionally care coordination. I think that those are going to be critical within this area, but I absolutely see rural health winning out in this bracket.
I mean, we're calling folks for an early upset here to hear my friends on the policy side of the bracket talk so persuasively. So certainly pay attention. Stephanie, keep the mic in hand for a second. Healthcare M&A under fire. Price and access are implicated here with mixed enforcement. State oversight continues to tighten. James has already called out the challenges that are out there around some of the transactions. And in your very world, quality and safety, like with the work that Leah and her team at Leapfrog do, quality and safety has shown time and again to be diluted in an M&A environment in which we have lived for some time. But price transparency can't quite be overlooked. Certainly, the Consolidated Appropriations Act and the Trump administration the first time around and its enactment doubled down on with the Biden administration and continuing to be sharpened in its focus in this current version of the Trump administration as an example of the way that we think about price transparency efforts around the country. Is this price transparency's moment when over the last several years we have seen a real struggle, and I think that's reflected here as it's dropped down to the 4 seed. How do you see this matchup shaking out? And then we'll go to Leah, Steve, and James.
Yeah, so talking about the healthcare M&A under fire, I mean, when I look at that, I think that in a lot of cases, for the reasons that you stated, we've really failed in execution. There has been a lot of excitement and a lot of energy around this topic, but when we look at how this has actually played out, we could see, to quote James Clear, we didn't rise to the occasion of our goals. We fell to the impact of our systems because we didn't set them up to to succeed. I've worked with a lot of organizations, and one comes to mind that had a lot of M&A and put themselves situated themselves to have 18 hospitals within their system, and they had 24 quality and safety committees and 36 hand washing policies. This is not playing out in the way that we would have hoped, and that's just a very simple example of failing in execution to really align, against those ambitions. So I'm not hot on that. What I am looking at is price transparency. I think back to my earlier comments, cost, affordability, and knowing how much something costs is critically important as we are trying to navigate the health system as consumers. And I think that the American public has absolutely had it with price transparency, and those conversations happen at my kitchen table as well. Wait, what was this bill? How did this happen? What was that for again? And so we have a real opportunity with price transparency, and so that's my pick.
Yeah, awesome thinking. And so, Leah, I'm gonna give you a shot at the quality dialogue here, which I feel like I know the direction you're gonna head. Like I had a sense of Stephanie's. These sort of feel like two sides of the same coin. From my vantage point, if the implications to transparency in a world where M&A continues to gravitate towards not just regional activity but cross-regional activity, Sutter Health now acquiring in California, now acquiring the Alina system in Minnesota, there are implications to price transparency in the way we think about the way transactions are continuing to unfold, not just the quality and safety world. How do you see this matchup shaking out?
Well, I think they're going to fizzle out by the end of the year, so I don't think they're as strong a team as they look to be in the opening round. Uh, so let me talk about M&A. We don't we look at quality and safety for individual facilities at Leapfrog, and uh, about 6 months ago we took a look at hospitals and what systems they belong to. Where are they housed in consolidated systems? And we found that first of all, 85% of them were in systems already. So in a way, this whole issue of consolidation is sort of in the rearview mirror now. And the question really is, how are we going to, how's it going to shake out and how we regulate them or how we assure that they're not uh, taking over markets as James pointed out earlier. But I don't think that those are major issues. I think we'll figure that out pretty quickly. The issue is we're not going to be able to stop them from consolidating because they already did. And by the way, we didn't see a major problem with quality or safety in consolidated systems, but since most of them are consolidated, it was hard to see that. But we really did see some systems where they were driving for quality and safety, and the results were showing. So there was some upside to that as well. But anyway, I think they're going to fizzle out. I don't think that's going to be the big issue. I think that telehealth is the same thing. I think that's happened. It's in the rearview mirror. We're going to have more of it. We're going to figure out how to make it all work, but that's going to be sort of an incremental issue. It's not going to be the big issue. They're going to fizzle out. They sound sexy right now, but they're not because it's already happened and it's happening. So I guess price transparency. I also think it comes off as a big deal to me. Everybody's rooting for them. It's been a big talk, the town, but I don't think they're going to turn into anything major either. I think what we're going to see is by the end of the year, or maybe by the end of 2 years, maybe as this team evolves, we're going to see prices all colliding toward a one mean. Everybody's going to have the same price. If we don't start to have more nuance in the marketplace and looking at quality and safety plus price, we're going to see all the prices are going to gravitate to the mean, and it's going to be kind of messy. And I don't know that it'll engage consumers the way we're hoping. So I think there's more we need to work on, and it's going to be a more nuanced issue than just price transparency. They're going to need more. In other words, they're going to need more talent on this team to really be effective as a major trend.
Steve, the healthcare M&A world impacts your community at a pretty significant clip. The HCA North Texas oriented division continuing to expand its ownership of urgent care organizations in that market, like other urgent care organizations around the country are transacting as well. But price transparency has a pretty significant amount of implication on this notion of on-demand care and what it looks like, and the pricing around it, and how that relates to care that's being given. How do you see this matchup shaken out? And then we'll go to James to round out our thinking, and as we move on to the third matchup.
I've got price transparency winning this matchup. So yeah, you're right. Like M&A has been an important part of urgent care specifically, but I think for now it's more of a defensive trend, and so sort of like a defensive battle right now. And so with that, I think price transparency, especially with enforcement picking up, has the potential to directly influence behavior. So I have price transparency advancing.
James, is this one of those middling matchups that's on during the middle of the week and some folks are watching it, but they're waiting to see more of what's going to happen on the other side with some of the other matchups heading into the weekend?
I think everyone's going to focus in on this matchup, in part because price transparency is just a very popular team. Like they sell a lot of jerseys. Thing is, they don't win a lot of games. They fall flat on their face, right? So the price transparency rules came out. Chamber of Commerce sued. Trump administration folded and said, you know what? We'll just keep drug prices secret. That rule came out in 2019. The year is 2026, and the machine readable files are still completely actually unreadable because they are chock full of useless fake data that we call ghost rates, like how much would a dentist charge for a heart transplant, right? And make these files completely useless to a consumer. Leah mentioned the consolidation that's already taken place in hospital world is so big that they don't even care how high their prices are. You can't embarrass them into lowering their prices, and they have no competition that would force them to lower their prices by seeing how much the competition is charging. So love the issue. Don't see it as going all the way. M&A, there's one. This is the one that's going to be big. People aren't seeing the potential here. They've got the best round picks. You've got a Department of Justice and an FTC that are invigorated in ways that you haven't seen in decades. You know, the FTC has kind of a long tradition of getting their butt kicked in court, and that's starting to change. And you're starting to see them settle with the biggest of the big companies, Fortune 10 companies, who are folding and agreeing to their terms. You're looking at these consolidated markets, and they're starting to say, we're not going to allow this to continue. We're going to start to reverse some of this trend. We're going to kill some of the incentives that these hospitals have to buy everything around them. So I see them potentially going all the way, which is why, everyone wants to watch the matchup with price transparency, but I think, they're actually the underdogs.
Love it. Stephanie, you called out the 6 seed interoperability gaining ground, and I love that you did, not just on the regulatory side where information blocking is now reaching a bit of an enforcement pitch. We've got regulations around APIs and connectivity, but perhaps there's now a moment. I reflect back on when the Office of the National Coordinator for Health Information Technology was first stood up, and my teams and I back at it and my old firm had the privilege of being alongside that administration. And I'll get to you in a second, James, to talk about that too, because I as well heard that promise. But perhaps after all this time, to call you out a little bit earlier, has interoperability gained ground enough to overtake telehealth at a crossroads?
Yeah, I think that interoperability is a critical issue, critical team to be cheering on. I think that the American consumer is really expecting and demanding this. I reside in the Chicago market, and I move between systems and providers constantly based on what my healthcare needs and preferences are. And I find it maddening that I have, four different apps in my healthcare, a digital wallet that I'm moving through, whether based on what system I'm engaging with, and I find it incredibly frustrating. And I think that my personal healthcare is worse off because of it, even though I'm trying to navigate the system myself and get to the right providers. it's not connected then after the fact, or before the fact with all the data that needs to flow through. So I think that it's a huge issue. I will also point out the hopefully not insurmountable challenges that will result as we see this positive, hopefully positive movement and interoperability is really going to be a game changer for the system. So we see systems struggling to navigate their own information and their own data. And now to have that moving across systems, I think is going to be a game changer for how we approach quality and safety, and really moves us from this sort of emphasis on data collection within a pretty an analyst between closed loop system to understanding it on a much more global level. And so I think that is that again from the workforce perspective, it's gonna push us. We're gonna have to behave differently, and in order to really make sure that if this takes off, that we can not fail in execution.
Yep, I appreciate all of those perspectives, James. The telehealth at a crossroads piece is such an interesting way the seating committee put this one as a potentially strong three seed, especially when you look at health systems advancing now a more aggressive movement into the telehealth space. We've got the recent announcement of UHS acquiring Talkspace. We've got Metro Health and MUSC, the Medical University of South Carolina, starting their own company in the absence of private equity backed companies out there in Ovation, who the CEO of whom of which is in our pioneer bracket. Is telehealth at a crossroads, but perhaps in a way that could benefit us as the general consumer, or is interoperability gaining too much ground?
I like this matchup. It's the battle of the e-health. I'm gonna want to build on something that Steve said. He said telehealth had a Cinderella story during COVID. Keep in mind, at the end of Cinderella, she moves into the palace and marries the prince. Okay, big beautiful bill made a major change to telehealth policy. It said for the ever from now on, the new rule is if you have a high deductible health plan, you can get free telehealth. Period. Full stop. Never going to expire. That's more than 60 million people now who are going to be saying, well, wait a minute, if I go into the office, I'm going to have a copay, whereas if I use the app, it's free. This is going to be huge. It's going to lower prices, not just for those consumers who aren't going to have to pay the copay, but for the employers that I represent. Telehealth is actually cheaper than in person because you're not paying for the brick and mortar and all of the exciting, extra rooms where they move you from one room to the other and they've got somebody shuffling you around, etc. Don't need to pay for any of that. Okay, we're going to save big money on this. I think telehealth is having a moment. It's only gonna grow from here. People are gonna see increasingly that they have less and less of a reason to travel to the office and get exposed to everybody else who's sick. I think that this is a sleeper. It's gonna be one that's gonna go far in the tournament.
Steve, I'm going to ask you to double dip here, my friend. Let's look at telehealth at a crossroads, interoperability gaining ground. You've heard the arguments, you've heard what I'm confident is some persuasive commentary, and then I also want you to stick with it and weigh in on our last matchup in this bracket, the drug pricing shakeup versus specialists under the value lens, and give us your perspective on behalf of the all urgent care organizations everywhere. But more importantly, the notion of on demand care continues to be so relevant, not just in primary care as a substitute or a proxy, but now even when we think about specialists and the implications to 340B and otherwise. You guys are right in the middle of both of these.
So I have telehealth beating interoperability in this round here. I think both are critical. But telehealth, as I mentioned earlier, is at a true inflection point right now. And I think, policy decisions will determine whether it scales or pulls back. Interoperability is a very fundamentally sound team, not flashy, but critical to winning. And I think as data sharing improves, it allows operators to move from being more of a standalone type visit to becoming part of a coordinated care journey. And that's been one of our industry's biggest challenges, quite frankly. So, Yeah, so I think I think I have telehealth advancing here, and again, as I mentioned earlier, the future to me isn't virtual versus in person. It's how the two work together, and then drug pricing. I've got drug pricing beating specialists under the value lens. I think there's a massive financial impact and very strong employer focus here, as we know, around drug pricing. And but it's more about cost control than care delivery. And I think specialists under the value lens is a very interesting lower seed. I think as specialists are increasingly measured on value and not just volume, where patients enter the system becomes more important. And that certainly creates some pressure on site of care decisions. And I think it'll be important to ensure patients are directed to the right setting up front. But I've got drug pricing winning this round against specialists under the value lens.
Love that. Leah, I'm going to ask you to double dip here as well. And after you've heard some of the commentary on telehealth and interoperability, I'm curious where your opinion sits, given some of your earlier comments. And I know you want to focus in on that number two seed, drug pricing shakeup versus specialists under the value lens. Both, interestingly, implicate or call the question of whether CMS programming in particular is going to be at the forefront of the way that we think about both of those, not just CMS in the instance of drug pricing, but certainly as we think about the 340B program. But we now have two programs on the drug pricing side that are targeted around drug pricing. We've got the new Globe model, the global benchmarking for efficient drug pricing, and the GUARD model, guarding U.S. Medicare against rising drug costs. I do have to constantly look at my cheat sheet because I can't remember all the acronyms that HHS is continuing to put out, but I do love them. They're certainly creative. Both interesting, looking at international benchmarking for the first time rather than domestic benchmarking, but it's the 340B program, it feels like, that has such regulatory implication here versus specialists who also have their own new models, not to be outdone. Specialists in the CMS portfolio now, between the team model focused on mandatory accountability and the ambulatory specialist model, thinking about the advancement beyond the acute care world, all now sort of have a program of their own to call to question. So I'm curious, as you round out your thinking in this side of the bracket, how does this shake out?
Well, looking at that last bracket with drug pricing versus specialists, I think the specialists under the value lens is a team we watch every year. We hope and pray that they do well, but they don't. They just always disappoint. We wanted value to really have an impact on specialty care and just have a new approach, but it's just there's a lot of built-in just structural issues that are really preventing this team from getting very far. And that's going to be the case, I think, this year as well. Drug pricing, to your point, Josh, that I think there's a lot of momentum around this, both from the federal level, but also, again, at the consumer level. It's always been a big issue for consumers. I think what the administration has been doing is aligning some of the policies with what consumers want, with something that's very visible to consumers. I'm not sure where 340B is going to go for that reason, by the way. I think 340B is not as visible to consumers, and there's certainly a lot of opposition to a major change in 340B. So I don't know about that aspect of it, but I certainly think that generally drug pricing in a whole variety of settings will be impacted. And I think we've seen already real momentum. As I mentioned earlier, 2/3 or something, the cash price for in the marketplace, the cash price for the obesity medications, the GLP-1s, has gone down by like 2/3. You don't see drug prices go down like that. So, and that's a market-driven phenomenon, but it's also fueled by some very smart policy. So I really see drug pricing as the one to beat, certainly in this category. I think they'll definitely, they're the front runner. And then in terms of telehealth versus interoperability, I guess I have to agree with, I think James, especially talking about telehealth is just such a force. I really do see that as changing. And Steve also, I think I have to agree. I think that's the one. That's the one this year. That's going to. I don't think they can win. I think they're going to get far though, because it's just something that has so much momentum to it.
James, any thoughts on the drug pricing side versus the specialist side that you think would sway folks one way or the other here?
Look, I'll just say the United States is around 5% of the world's population, and yet Big Pharma makes between 50 and 75% of their profits right here in the good old US of A. This is not a situation that is sustainable. This is not a situation that is only the realm of people in a certain economic class or a certain part of the country. It's hidden every family. When people talk about affordability, this is what they're talking about. This is the hottest issue out there. This is the team to watch.
Yeah, it certainly feels that way. This is one of the matchups in the entire bracket that I was particularly focused on because I too want Stephanie the promise of specialists under the value lens to realize their moment, but it could be a situation where we've got a two seed in drug pricing shakeup that really goes deep. How do you see that? Is that based on what your colleagues are reflecting on and your general point of view from the NAHQ vantage point? How do you see that unfolding?
Yeah, I'm gonna agree with Leah with the specialists under the value lens, and that we really have struggled to have that materially impact and make the differences we would hope and expected it would. And I'm going to suggest that, one of the reasons why that has happened is because when it gets all the way down to the line in execution, is where things really break down. The policies are ambitious and I think appropriate, but when we get into the workforce actually implementing it, we know that they're not prepared to do that. So we have some research that has confirmed that about half of people working in healthcare do not know what a value-based payment model is. And we think that that is a big cause, a root cause of why we haven't seen the success that we've wanted to. We have hopes and dreams and ambitions and mandates and policies, all driving towards this, not just in the specialist category, but obviously many others. And I think we've really left the key to the lock behind on this, and that is workforce. So I support the directionality of the specialists and the value initiatives. I just don't think it's going to be as strong a team as the drug pricing shakeup. I absolutely agree that the consumer perspective on this is tremendous. I was not familiar with the data, the stat that James put out there about 5% of the consumption happens in the United States, and yet 75% approximately of the costs are bared by the United States. That's absolutely unacceptable, and I think that for that reason, we are going to see the drug pricing shakeup team advance, and I think they might take all.
Love it. So that brings us to the last question, speed round, yes or no. Stephanie, is the winner of this year's March Healthcare Classic going to come from the policy bracket, side of the bracket?
I think it will. I think there's a really, really strong chance. I think drug pricing is, obviously, as we've mentioned, an incredibly important and urgent issue for not only the American public, but by result, the administration. And we're seeing a lot of really strong movement and progress in that area. And so I absolutely think that drug pricing shakeup can absolutely win the entire show.
Leah, is the winner of this year's March Healthcare Classic going to come from the policy side of the bracket?
No, absolutely not. I don't think so. I don't think policy moves very quickly. And what moves fast is markets and people and consumers, which is why I think AI is going to take it. And AI, the influence of AI on the provider side has almost, almost just shockingly large potential. And it will be driven not just by the providers themselves who are using this technology, but also by consumers who are using this technology at home We're just beginning to see the influence of AI in everything, but it's going to have a huge impact, already is, on healthcare and expectations of healthcare and consumer use of and consumer interaction with healthcare. I just think the influence of that is just its moment has come and it's going to be enormous. So I think it just completely overshadows whatever policy we'll be able to capture in this tournament.
Two different perspectives, but both equally compelling. Steve, are you swayed? Is there a policy winner in this year's March Healthcare Classic?
I don't think so. But just for the record, I've got price transparency winning this bracket. But that being said, if I've got an overall champion for the full bracket, I'm going with acceleration of direct contracting. I think that's what, yeah. I think that's what pulls the system forward. It changes who makes decisions, how care is purchased, and where patients are directed.
Love it. James, last comment here. Is there a policy winner in this year's Classic?
Hey, I'm a big fan of Dr. Google, use it all the time. I think that the winner is in the policy bracket. If it's not the drug pricing shakeup, it's going to be healthcare M&A under fire.
I love it. It is indeed a good Friday when we get to film with the four minds that we have shared our virtual stage with here today. Cannot thank you enough. Happy Easter, happy Passover, a happy every day to everybody. When you get to hear this kind of policy thinking, hopefully it informs the perspectives that will impact not only the way that you think, but it'll impact our industry over the course of the next 12 months. Thanks so much for sharing time with us.